Rheumatoid arthritis. What is rheumatoid arthritis? It's a chronic inflammatory autoimmune disorder that can affect more than just your joints. The condition can damage a wide variety of body systems, such as the eyes, the skin, the lungs, the heart, and blood vessels. It occurs when your immune system mistakenly attacks your own body tissues. Unlike the wear and tear damage of osteoarthritis, rheumatoid arthritis affects the lining of your joints, and it causes painful swelling that can eventually result in bone erosion and joint deformity. Signs and symptoms of this are tender, warm, swollen joints, joint stiffness that is usually worse in the morning and after activities. Worse in the morning is a classic sign of it. Fatigue, fever, and loss of appetite. As the disease progresses, symptoms often spread to the wrists, knees, ankles, elbows, hips, and shoulders. In most cases, symptoms occur in the same joints on both sides of your body, so bilaterally. And rheumatoid arthritis signs and symptoms may vary in severity and may even come and go. Causes. It occurs when your immune system attacks the lining of the membranes that surround your joints. The inflammation can eventually destroy the cartilage and the bone within the joint, and the tendons and ligaments that hold the joint together weaken and stretch, and gradually the joint loses its shape and alignment and it becomes painful. Risk factors are women are more likely to get it than men. It can occur at any age, but it's mostly common in like the middle age. If a member of your family has it, you may have an increased risk of getting the disease. Cigarette smoking increases your risk, and also people who are overweight and obese are at a higher risk too. Complications. Osteoporosis you can get from this, rheumatoid nodules, dry eyes and mouth. You can get infections, abnormal body compositions, carpal tunnel syndrome, heart problems, lung disease, lymphoma. You can also have kidney issues too. So there's a lot of complications that come along with this. And it's all due to like inflammation. For a diagnosis, it can be difficult to diagnose in its early stages because the early signs and symptoms mimic those of many other diseases. There is no one blood test or physical finding to confirm the diagnosis. The doctor will check your joints for swelling, redness, and warmth. He or she may also check your reflexes and muscle strength. Also, you'll have an elevated ESR or CRP, which may indicate the presence of inflammatory. So those are two tests that they can do to see if there is inflammatory in the joint. Other common blood tests look for rheumatoid factors and anticellulic peptides, so anti-CCP antibodies, which that's just a blood test looking for it. X-rays to help track the progression of RA in your joints over time. So an X-ray will help the doctor confirm this diagnosis, and also an MRI and ultrasound test the doctor could possibly send you for and see the severity of your disease and to keep an eye on it if you're already diagnosed. Treatment. Unfortunately, there is no cure for rheumatoid arthritis, but clinical studies indicate that remission of symptoms is more likely when treatment begins early with medications. DMARDs are popular for this, methotrexate, and there's a couple of other ones too, but that's just one of them. NSAIDs, because they relieve pain and reduce inflammation, so like ibuprofen, Motrin, same. Steroids like prednisone your doctor might put you on to reduce inflammation and pain and try and slow that joint damage. And then biologic agents, which these are a newer class of the DMARD group, and it can slow the progression of rheumatoid arthritis and save the joints and other tissues from permanent damage. Humira is a popular one. You see it on a lot of commercials. There's a list of them. There's a couple, but Humira is the one that I recognized. So yeah, those are definitely treatments and medications that your doctor may prescribe you. Other treatments are PT and OT to work on your motor skills. They can help you teach you skills and exercises to do to help your joints open up, and they also can teach you how to use utensils and any other to open a jar. They have special equipment, and they can help you with your ADLs and make it easier, especially for people who have really severe RA. Also, surgery is an option. You can do a total joint replacement. And during that, your surgeon removes the damaged parts of your joints and inserts a prosthetic metal and plastic one, or plastic one. Or you can do a joint fusion, and you're surgically fusing the joint together. It may be recommended to stabilize or realign a joint, and for pain relief when a joint replacement isn't an option. So lifestyle treatment, recommend definitely low weight bearing exercises, and it can help strengthen the muscle around your joints, and it can help fight fatigue you might feel. The low bearing weight is very important. You don't want to do strenuous exercise. You don't want to go running 1,000,000 miles or lifting heavy weights, but exercise definitely is important and can definitely help. You can apply heat or cold. Heat can help you ease your pain and relax tense and painful muscles, and then cold may dull the sensation of pain. Cold also has a numbing effect and can reduce swelling, so that's another one, important one you can do at home. And relaxation, so find ways to cope with the pain by reducing your stress in your life. You can use guided imagery, deep breathing, muscle relaxation can all be used to control pain. That's a really if you can rest and relax. Evaluation. So overall, early treatment is very, very important, but catching it early is also hard because of how I mentioned earlier. The signs and symptoms can kind of mask or look like other diseases. Learning which medications are best for you and what makes the pain hurt less. So basically, you're probably going to use a couple medications, which NSAID you like best, or which really reduces the inflammation the most, like applying heat or cold. And then PT and OT to help as the RA progresses. That, again, when it gets bad, like the picture over there, you're going to need the special utensil using stuff, the lid opener, and they have a bunch of other ones too to help you. And that's just important to be proactive about it.